Hey guys, welcome back to Midweek Mobility. I'm Dr. Claudia Chandler with Movement RX. So today we're going to be talking about the largest joint in your body, that is your knee. Okay, this is a very complex joint, but we're going to be talking specifically about patellofemoral pain syndrome. If any of you guys have had or experienced knee pain, gone to your doctor, you've been diagnosed with this and you're not really sure what's going on, it's a very broad term, okay? So it's not really telling you anything about what's the cause of the knee pain or what's exactly going on with that knee, okay? So you might also have been termed with jumper's knee or runner's knee. You're gonna have pain going up and down stairs, maybe with running or jumping, also with repeated squatting. You also might have stiffness after you've been sitting for long periods of time, or you also might have some popping and cracking when you bend and extend that knee. So some causes for this, there's multiple causes that can go into patellofemoral pain syndrome. So the first one is decreased ankle dorsiflexion. So when we're going into that squat position, if we don't have adequate ankle range of motion, so my ability to flex my foot up, okay, if I don't have adequate range there, what typically happens is my toe will flare out and then my knee will collapse in. So a lot of extra strain through that knee, okay? We can also have excessive ankle pronation. So again, kind of the same mechanics going through that. If I have my ankle collapsing in, that's going to encourage that valgus position of my knee. This can happen with running, also with squatting and doing other movements. We have decreased hip strength, specifically with those lateral structures, those abductors of your hip. When we go into our squat position, we don't have the ability to hold our hip into this nice position here, and we can get this fall inward of our hip, this internal rotation. We can have an imbalance with your quads and posterior chain. Any kind of imbalance there will put extra strain on the knee when we go through activities. Decreased hip external rotation. So if we don't have the ability to externally rotate or drive our knees out into this open position of our hips when we squat, and then we can get this collapse in again, especially if you go under heavy loads. It just doesn't have the range of motion for that. Tight adductors. So again, this goes into that squat position. If these inner muscles here are super tight, it's not going to allow us to open up those hips and get into that nice open squat position. Further up the chain, poor core stability. So if we don't have a solid core to build our foundation on for our extremities to move, especially if we're running for long distances, if we don't have that, then we can cause a lot of rotation with our hips that are going to lead down the chain into our knee and our foot. And again, all of these things can cause malalignment of the knee. And what this is your patella moves in this nice groove along your femur. And so when we have tightness or weakness with any of the structures in our hip or even down the chain into our calf or foot, then we can cause some wear and tear abnormally on one of the sides of our patella. This can cause inflammation and pain, okay? So some different tests to go through to kind of look at, what your positioning is, what's happening, is ankle range of motion first off. Dr. T did an awesome job about covering that with shin splints last week, so I'm not going to recover that today, but have a look at the test that she went over. Single leg squat, squat jump, and then hip rotation, okay? So we're going to go into the single leg squat position. We want to make sure that we can keep our foot flat on the ground. We're driving that knee out, having good control as we sit back. You can do this to a chair or a box, whatever you prefer. Going down, making sure that knee is in a good position. We do not want this position, because if we can't control our body weight on that one leg and we have this position happening, then what's possibly happening when you're running for several miles? Got a lot of extra strain on that inside of your knee, okay? The squat jump, you're going to get into a squat position. You can go all the way down into your squat, or you can just do like a mini squat jump. You're exploding up and catching, okay? I'm looking at my knee position, so what we don't want is this to happen, okay? I'm going into that valgus knee position as I explode up. I'm also catching in that valgus knee position and then driving out. So we want to be able to maintain that nice position with our knees, push up and back down, okay? The hip rotation one, you're going to do this one seated. We're looking for hip rotation, external rotation, we're looking for about 40 degrees. So if this is 0 degrees, this is 90 degrees, we're looking for about 40 degrees there. So I'm going to actively bring my leg up, keeping my femur on the box or the chair, wherever you're at there. So that's external rotation, and that can also check my internal rotation, which is going to be, we're looking for about 30 degrees there. Again, 0, 90, looking for 30 there. Okay? So try these tests out, guys. If you guys have any questions, feel free to give us a call. Have fun with it.